Hello and welcome. Today we shall be looking at 10 NCLEX questions that can be tested on cardiopulmonary resuscitation, automated external defibrillation, and foreign body airway obstruction. These questions come with answers and rationale, so let's practice together. Question number 1. Which action should the nurse prioritize when initiating CPR on an unresponsive adult with absent breathing and a pulseless rhythm? A. Assessing the airway for obstructions. B. Beginning chest compressions. C. Administering epinephrine. And D. Providing rescue breaths. Pick your answer. Now let's compare. The correct answer is B. Beginning chest compressions. When an adult is unresponsive with absent breathing and no pulse, the priority is to initiate chest compressions to circulate oxygenated blood. Question 2. When performing CPR on an infant, what is the recommended compression depth? A. 0.5 inches. B. 1.5 inches. C. 2 inches. D. 2.5 inches. What's your answer? Well, the correct answer is B. 1.5 inches. For infants, the recommended compression depth is about 1.5 inches. Question 3. What is the appropriate compression to ventilation ratio for one rescuer adult CPR? A. 30 compressions to 2 breaths. B. 15 compressions to 2 breaths. C. 5 compressions to 1 breath. D. 10 compressions to 3 breaths. What's your answer? That's an easy one. The correct answer is A. 30 compressions to 2 breaths. The compression to ventilation ratio for one rescuer adult CPR is 30 compressions to 2 breaths. Question 4. After attaching an AED to a victim, what is the next step for the nurse to take? A. Continue CPR for 5 minutes. B. Administer a shock if advised by an AED. C. Perform a head tilt chin lift maneuver. D. Check for a pulse. Pick your answer. The correct answer is B. Administer a shock if advised by the AED. If the AED advises a shock, the next step is to administer it. Question 5. An infant is choking on a piece of wood and is unable to cough forcibly. What should the nurse do first? A. Begin back blows and chest thrusts. B. Perform a blind finger sweep. C. Encourage the child to cough. D. Begin back blows and abdominal thrusts. Pick your answer. The correct answer is A. Begin back blows and chest thrusts. For a conscious child who is choking and is unable to cough forcibly, the nurse should begin with back blows and chest thrusts. Question 6. Which assessment finding indicates successful relief of a foreign body airway obstruction in an unconscious adult? A. Persistent coughing. B. Audible wheezing. C. Return of normal breathing and chest movement. D. Increased heart rate. Pick your answer. The correct answer is C. Return of normal breathing and chest movement. If foreign body airway obstruction is successfully relieved, normal breathing and chest movement should return. Question 7. A 65-year-old patient collapses in a grocery store. Upon assessment, the nurse determines the patient is unresponsive, not breathing, and pulseless. What is the immediate action the nurse should take? A. Call for help and begin CPR. B. Assess the patient's level of consciousness. C. Retrieve the nearest AED. D. Administer rescue breaths. What do you think is the answer to this question? Well, the correct answer is A. Call for help and begin CPR. In this scenario, the immediate action is to call for help, activate the emergency response system, and begin CPR. Question 8. During infant CPR, if two rescuers are present, what is the preferred method of providing rescue breaths? A. Mouth to mouth and nose to mouth. B. Bag mask ventilation with a pediatric mask. C. Mouth to mouth with a barrier device. D. Nose to mouth and mouth to nose. Pick your answer. The correct answer is B. Bag mask ventilation with a pediatric mask. When two rescuers are present during infant CPR, the preferred method for providing rescue breaths is with a bag mask ventilation using a pediatric sized mask. Question 9. While performing CPR, the nurse observes the victim's chest rise and fall with each ventilation. What action should the nurse take next? A. Increase the rate of compressions. B. Continue with the current sequence of compressions and ventilations. C. Pause compressions and reassess the airway. D. Administer a higher concentration of oxygen. Pick your answer. Now let's compare your answer to what we have. The correct answer is B. Continue with the current sequence of compressions and ventilations. If the chest rises and falls with each ventilation, it indicates that the airway is open and that ventilation is effective. The nurse should continue with the current sequence of compressions and ventilations. Question 10. Which condition is a contraindication for the use of an AED? A. Ventricular fibrillation. B. Pulseless ventricular tachycardia. C. Asystole. D. Respiratory distress with a palpable pulse. What do you think is the answer to this question? The correct answer is C. Asystole. Asystole is a flat line rhythm indicating no electrical activity in the heart. It's a flat line rhythm indicating no electrical activity in the heart. It is a contraindication for the use of an AED, as defibrillation is not effective for asystole. Thank you so much for watching this video. I hope it has been of great value to you. I will be posting more videos in my YouTube channel. Check them out. Subscribe if you have not subscribed to this channel so that you can get prompts on more videos as they get posted. Thank you again and goodbye.